All right, welcome back to the brain injury discussion. This is your host, Jay. Today we're going to talk about four different types of brain surgeries that deal with intracranial pressure. Like always, sources will be in the description below. We'd appreciate if you give this video a like. We do appreciate when we get those thumbs ups. Also, we'd appreciate if you subscribe to the channel. It really helps us out. We put out this information weekly. We try to keep it informative, educational, but also applicable. Also, leave a comment down below if you have a suggestion for an upcoming topic. We'd love to hear those. But with that being said, I know we have a lot to get into. We're talking about brain surgery. This might be a little bit of a different type of subject, but at least we'll be able to differentiate the different types that we're covering today. But with that being said, we got a lot to get into, so let's get started. So first is the oldest type of surgery for the brain or to the skull, really, and that's something called trepanation. We have a video on our channel about ancient brain injury from Alexander the Great's time and up to medieval times, and we'll see that trepanation really comes up in those kinds of situations, and we see that per Dr. Paul Broca, yes, of Brocas area, the guy who also worked with Alzheimer's. We find that trepanation is defined by him as in which a hole is made in the skull by cutting or drilling it. This might seem like a wild thing to do, but this is used to relieve pressure in the skull, as we see in this drawing to the right here. We see that there is drilling happening to help relieve that pressure. Maybe there's excess fluid in there. Maybe someone had a really big blow to the head in an accident or maybe a fight. And so if there's bleeding or if there's excess fluid there, it is causing extra pressure on the brain. And so what happens is that you need to drill a hole to relieve the pressure. That way the fluid can escape. This kind of surgery also dates back thousands of years, and it was documented by Hippocrates, which is also the same person that we get the Hippocratic Oath from. And this was documented somewhere around 400 BC. So 2,500 years they're doing brain surgery. So brain surgery is not necessarily a new thing. I think the tools might have changed, gotten electrified. Maybe sterility is a bigger factor these days, but brain surgery is not necessarily a new thing. Or really, shall we say, skull surgery or skull drilling. That in and of itself is not a new thing. It's been around 2,500 years. And it's always interesting when you see these drawings from either a few hundred years ago describing this sort of surgery. And that, again, we're going to get into what this looks like in the modern day and age. But for those history buffs out there, this is certainly an interesting thing to talk about. So let's move forward a couple thousand years, well, 2,500 years, and let's talk about a craniotomy. Now, when I see the word craniotomy, of course, cranio, which is the skull, the skull is also known as the cranium. And so when we see cranio, that's the skull, otomy, which is removal of. So we have those two parts there. We have the root word and the suffix, which again, otomy means removal of. Per the definition, per the source down below, you'll find it in the description. A craniotomy is a surgical procedure in which part of the skull is temporarily removed. Now, again, I stress temporarily on that definition. It is used to expose the brain and perform intracranial procedure. Now, you might be asking, well, Jay, you stressed temporary. You're talking about the craniotomy, which is to help expose the brain and perform an intracranial procedure. Now, what this might be used for is you're moving part of the skull to access the brain. And again, we're talking about brain surgery. We should know about these things, or at least be aware of these things as brain injury case managers. And so what is a craniotomy used for? It is used to help address brain tumors. Now, in order to get a tumor out, you might have to perform a craniotomy to allow that tumor to come out. Maybe it's also a way to help address subdural hematomas or intracerebral hematomas or bruising, swelling, bleeding. It also could be used for aneurysms. Again, the brain has blood vessels, and those aneurysms they can happen. Cerebral aneurysms do happen, as well as a bunch of other conditions. And so a craniotomy is, again, that temporary removal. So you can go in and do the same thing. A way to describe this is if you have an engine to a car and you remove the head of the engine temporarily, and then maybe a gas gets worn out or maybe something broke inside there. You remove the head of the engine to get and fix the part, and then you put the head back on so it'll run again. And so the craniotomy is, again, the temporary removal of part of the skull. Again, usually that part will be placed back and covered up, as we see in this graphic here to the right, where we see a successful craniotomy. And we can see that that skull, or the pieces of the skull that were removed, were placed back and then basically fixed into place, which will allow for healing, which will allow for extra protection of the brain. The skull is a layer of protection for the brain. And so having a craniotomy means that they're taking it out temporarily so they can go into the brain and address something, and then they put it back into place. So, with that being said, we talked about the temporary removal of the skull. Let's talk about the longer lengths of that. Let's talk about what's called a decompressive craniectomy. And we're going into specifically craniectomy. So, again, we see that word crani, which is the skull, and then ectomy. Specifically, ectomy means removal of permanently. And so, per the definition, the craniectomy is removal of part of the skull to treat swelling and bleeding. That's the decompressive part. It is used for treating subdural hematomas with swelling that is lasting over a prolonged period of time. Again, you can't really put back the bone or the skull together if there's going to be prolonged swelling. And so what this is that you're removing that to allow for work to be done and also to relieve pressure. The brain, when it gets under too much pressure, gets damaged. And so this is a way of addressing something like a subdural hematoma. Also of note, per the source down below, this is usually the last resort for intracranial hypertension. Again, the last ditch result for that swelling or that increase of pressure inside of the skull, which leads to damaging of the brain. Now, what I found interesting is that usually this causes that part of the skull that was taken off to be discarded of that section and possibly requiring what's called a cranioplasty. Now, if you are curious, you can go back to our medical terminology video. But a plasty, when you see that at the end of the end of a certain word, like cranio, what does that mean? Well, cranio, talking skull, plasty, which is putting in something else to, obviously take care of that or to artificially put something in place. Think of the word plastic or molding something. And so when we see cranioplasty, they're basically taking artificial what they took out, and they're going to take an artificial, basically what they took out, and replace it because the skull is part of the protection of the brain. And so a cranioplasty is where they basically take what they took out and replace it with something new, especially when it comes to a long period of time of swelling. Maybe that swelling does go down after a while, but that skull fragment is already discarded. And so what they have to do is they have to make an artificial one to put it back into place. So there is a difference between craniotomy and craniectomy. Craniotomy is very temporary and they put it back in place. A craniectomy, usually they don't put it back in place, or it'll be put back in place in a longer period of time. And so that time part is very important. Let's talk about another kind of surgery, which again, less invasive in this case to address pressure. It's called a ventriculoperitoneal shunt. Now, let's break this word down. Try saying it 3 times fast. ventriculo, which is talking about the ventricles, which, as we see in this graphic, are near the center of the brain, and peritoneal, so again, within the body, and then a shunt. And that is the interesting thing, is a shunt. A shunt is used to divert fluid away from, or to create a way for fluid to escape. Per the definition, the ventriculoperitoneal shunt is the cerebral shunt used to treat hydrocephalus. We have a video on hydrocephalus as well as a little bit in there about shunts. But what the shunt does is it removes excess cerebrospinal fluid. Now, that is a very interesting topic because the brain is under some pressure under normal conditions, but it's not under a lot of pressure. But if you had a lot of fluid in there, it's going to increase the pressure, thus causing damage and injury to the brain. And so, what we see with hydrocephalus is that there's extra pressure within the skull, but that shunt allows for that excess fluid to drain from the skull. And again, as we see on this graphic, it's a little tube that goes into the peritoneal areas of the ventricles. So if they swell up, they get extra fluid in there. It allows for that fluid to again be shunted out and pushed out of the skull and into what's probably the abdominal cavity. Maybe there is a dysfunction in the usual drainage. And so what we'll see is that this is a very, not necessarily common, but this is something that we should be aware of. And usually they will have valves to help control that pressure, or maybe to control the on and off switch. And so as a case manager, I need to be aware of these things. I need to be aware of the term craniotomy, craniectomy, and ventroperitoneal shunt, because not necessarily that they're just operations that pertain to the brain, but there is a brain injury there, regardless of, okay, maybe they have to do a craniotomy, craniectomy, or ventroperitoneal shunt to address the brain injury. Thus, it might be considered a brain injury itself, but there is a brain injury there. And so, being a brain injury case manager, it would behoove me to be aware of these kinds of terminologies. So, what does this leave me as a brain injury case manager to conclude? Well, first, we need to be aware of these surgeries because it's not necessarily just the surgery, but they're the brain injury that caused the surgery. Think of the cancer, think about that tumor, think about the hydrocephalus. Again, those are some examples: subdural hematoma, intracranial hemorrhage, aneurysms. Those things can happen. And so being aware of the term of the surgery helps us determine what was the brain injury. It's also good to be informed about the differences between these surgeries. That way, when we see medical documentation, we can discern really about what happened and then what to prepare for after that. Knowing what to expect starts with the cause, which leads to the effect. Again, I say that as if I see that someone has had a craniotomy, I should start asking the question, why did you have the craniotomy? Was it a subdural hematoma? Was it a tumor? Was it a cancerous neoplasm? Was it a cerebral aneurysm? What happened there to cause that? And when we're able to ask those questions, we're able to get those answers and then apply preparation, which again leads to my final point here. Preparation, sometimes it requires research. If I don't know what a term is, I should be able to research it. I should be able to find out what it is. Same thing, when we do research, it increases our understanding, and then it also increases our wisdom. Our wisdom is the ability to take that knowledge and use it practically for the better. And usually, when we're able to take that knowledge and use it for the better, it leads to better outcomes for our clients, for our brain injury survivors. And that's why this research is very good to do. But with that being said, here are my references. Feel free to look them up. They're always very interesting to me. They can be kind of long, kind of bland and boring at times, but that's why you have me. I'm boiling down the information into a digestible, applicable, but also informative informative manner. Also, I'd appreciate if you subscribe to the channel, maybe leave a like. We do appreciate when we get those. And also, we do appreciate when we get a thumbs up. But also, leave in the comments down below if there's a topic you want us to cover. We're always looking for new topic ideas. If there's something that you want us to cover, we greatly appreciate your feedback. But with that being said, I hope everyone has a wonderful day. And don't forget, protect your brains.